professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome.
Good evening. My name is Patty Villa, and you're here with us today. And as a guest, our doctor is Dr. Kovacs from Florida Medical Center, and you are listening and watching You and Your Doctor. Dr. Kovacs, welcome to the show.
Thank you very much. It's a pleasure to be here.
Thank you for coming. One of the things I wanted to start off with, and you and I were talking about this, and we've spoken about this in the past, is sometimes people at certain ages still haven't gone to the doctor. So what is it that a person needs to know or can expect when they have their first visit to the doctor's office?
I think that's very important because you cannot make a second attempt at the first impression. I think you should plan it. It's a very good idea. And you should go through in your mind what the doctor might ask of you to do. For example, if you call our office, my office, then we would ask you to come on an empty stomach. Every time if you go to a doctor, the easiest thing is to go on an empty stomach. That you can't go wrong with that. Bring in all your medications. No big deal. Just take all the bottles, dump them into a plastic bag, bring it in, and we will be the happiest people on earth that you thought of it. Also, please, if you need instructions or directions how to get to the office, please don't wait until 7:30 in the morning of an 8:30 appointment. Please call us a day or two before and we'll be happy to explain. You come... I'm sorry?
What kind of questions do you ask the person when they get to your office? How does the conversation start?
I'm sorry. My very first question is obviously, what brings you in today? Is there an emergency? Is this something that you've been planning to go to a doctor because you have not seen a doctor, have not been in the doctor's office for a long time, or ever? When I moved to Florida in 1980, and I have been next to Florida Medical Center since 1980, the average patient age was 75 in that area. Today, it's less than 40. So obviously, the patient population has changed. The 75-year-old people had heart problems. That's how Florida Medical Center developed into a heart hospital. Now, under 40, the most common problem is diabetes. And unfortunately, quite a few of my new patients who come to the office are diabetic, and they don't take it seriously. So I would ask them, what brings you to the office? Did your insurance company change? Did you like your doctor before, but the doctor moved out or retired? Or your insurance company and that doctor don't work together? And then depending on obviously what they tell me, the course of the interview is different. I don't like giving out a prepared questionnaire to my patients. I myself like to sit down across from the patient and we discuss everything. And I tell them, I have been working for 47 years on this questionnaire. I would bet that at the end there will be very few things that were, if any, that were left out. So we start talking about what the present problem is. So let's suppose it's a 35-year-old man who is 300 pounds and has diabetes. Then I ask, have you had any operations in your life, any broken bones? And some people go to bars and get into fights, and yes, their knuckles are broken or have been broken. And then after that, what medications you're taking? Are you allergic to any medication? Your social history. Do you smoke cigarettes? Have you ever been a smoker? Alcohol use? Drug use? Family history. Very interesting. When I came here in 1980, the most common family history was heart problem. Today, it is by far diabetes.
And I want to ask you about that because I have some diabetic members in my family. And I would like for the audience to know, what are the symptoms? If you don't know you're diabetic, what are the symptoms that come with having diabetes?
There are a few things that you can watch for. For example, women who give birth to a baby whose weight is 10 pounds or over, they have a very high chance of developing or already having diabetes. The other two things have to do with urination, passing urine. If you are passing urine frequently, large amounts, you may be diabetic. Why? Because if your blood sugar is higher than 180, the kidney is not able to reabsorb the sugar that was filtrated in the kidney in one part, and then the other part reabsorbs it, so that the sugar takes water out. So you're thirsty all the time and you're urinating a lot. And the other thing is that you're losing weight in spite of having good appetite and eating a lot. These are things that are very simple to notice for everybody, even without any medical education or knowledge.
And I want to share with you a personal story of a loved one, and I want the listeners and the people that are watching to know this story. I have a loved one that's actually in the hospital right now, and on April 10th, he had a kidney transplant. And it's all due to the complications of diabetes. And this is, like you're saying, very, very serious. People need to take this disease very seriously. And the people that are not following instructions from their doctors, what is it that you can tell them today that perhaps will get them to change their mind? Because my loved one, did not watch what he ate, did not test his sugar as regular as he should. And we started with a toe being amputated, one toe being amputated. And then now it was the complication a year later of needing the kidney transplant. He got the living donor kidney. But now he's in the hospital right now fighting an infection and fighting other complications because the doctors don't know why the kidney's not functioning. And this is something that means a lot to me, and that's why I want to educate the public on this subject.
The first thing that I would recommend to anybody is obviously to have a weight that is appropriate for the height of the person. Fortunately or unfortunately, we are a rich country. In the history of mankind, the biggest problem has always been not enough food. The last 200 years in the Western world, there has been no big problem with hunger. There have been occasional episodes, war, Great Depression, but in general, we have enough food. And I don't know whether it's our genes that are still telling us if there is food in front of you, eat it, or it is looking around yourself and see what your friends, neighbors, family members do, and you do the same. Nature or nurture, I don't know which one it is. Probably both. I don't know what combination. But losing weight to a desirable BMI, which is between 18 and 25, body mass index, when you compare the height and the weight, you come up with a number. Ask your doctor what your number is. 18 to 25 is normal. The lower your weight, the healthier you are, and the longer you live. Don't care about the people around you who will say, oh, you look like you are dying because you're so slim. I don't know if this is a good joke or not a good joke, but you will be bringing the flowers to their funeral because you're slimmer and so healthier. So that's one of the things. Behavior modification otherwise is very, very difficult. Just think about not smoking, not being an alcoholic, not being a gambler, not being a wife or husband beater. These are very difficult things, behavior modification. But there are certain things that you can do yourself. And I try to sit down with my patients and tell them, for example, about a rating system called Glycemic Index, and ask them to look it up online. Most of my patients are under 40, or make it under 45 or 50, under that age, and they know how to use their smartphone or how to use their computer. So I tell them there is a rating system that compares what happens in your body with your sugar level if you eat pure sugar, and that's the worst, and drink water, and that has nothing in it, no calories in it, so that's a 0. Eating sugar is 100. Everything is compared to this continuum. And try to eat foods that have a number in the rating system, in the glycemic index, which you can look up online, that have a number less than 60. And this is the simplest diet I can recommend to you. If you want an example, it's the Mediterranean diet. Also the paleo diet. You have a stone in one hand, a stick in the other hand, and you're walking on the prairie, and whatever you can find or kill, you can eat. Nothing else. These are simple diets. Diet is not this simple, but this is a good start.
And what other cases, what else are you seeing in your office besides the diabetes?
Because the area has a high percentage of African American population, we see certain inherited problems with anemia. Let me make it simple this way. Why is it important? Because if you have one bad gene, you may not know about it, but you can pass it on to the next generation. So to check in your family whether anybody has any problem, this is called hemoglobinopathies, you go to your doctor and you ask the doctor, would you please check my blood if I'm carrying any gene that I can pass on to my children that will not be in their best interest. And then if your child marries someone who carries the same gene, then obviously there's a much higher chance that their baby will have some problem. So it is a good idea to check it this way. High blood pressure, I don't even know if I should talk about it.
No, I think you should.
Because everybody,
I know, but
everybody pretty much has high blood pressure
yes,
today.
but there's people that are walking around that don't know that they have it. So what should people do?
One of the worst things is that that high blood pressure does not hurt you. And diabetes in the early phases does not hurt you. And when you have a problem that hurts you, if you have sciatica, if your knee hurts, if you have migraine, you go to the doctor. There is no question in your mind that you should go to a doctor. But when you have a problem that does not hurt you, you may not go, even if it is recommended to you. And this is where I think many people make the mistake. They don't take it seriously. And they have an occupation. It's very hard to tell a person, for example, one of my patients, 50 years old, a landscape architect, and works out in the sun, insulin-dependent diabetic. How can you tell to that person where he makes a reasonable, comfortable living that you should leave it alone, forget about this occupation, and train yourself for another one? How can, financially, it will ruin
Very
him.
difficult.
It's very difficult. So if it doesn't hurt and you are used to it, you're not going to take it seriously. So I try to sit down with them and discuss what you mentioned: kidney complications, complications with your eyesight, heart attack, stroke, and amputations of the lower extremity. And we are not like the salamander. If you cut off the salamander's leg, it grows back. If you cut off your toes, your foot, your leg, they don't grow back.
They don't grow
By
back.
the way, this is one of the things that there is research on.
And we're going to go to break because we know you have a lot to say, but we need to take a commercial break right now. We'll be right back.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Possibly. Hi, I'm Patty Villa. I'm sitting in for David DePino, and you are listening and watching You and Your Doctor. We're here today with Dr. Kovacs from Florida Medical Center, and it's just so wonderful having him here because he has so much information to share with you. Dr. Kovacs, we spoke about what people need to know when they go visit the doctor. We spoke about diabetes and what people need to do to prevent it or to control it. And now we want to talk about the hyperbaric chamber. Tell us how the hyperbaric chamber can help a diabetic person.
The complications that go with diabetes, or one of the complications, is problem with the circulation. And when your circulation is poor in your legs and in your feet, even a tiny little scrape or bruise can turn into a sore, an ulcer. And it just doesn't want to heal because there is lack of oxygen. Now, there are two ways to improve the amount of, or increase the amount of oxygen that goes to the leg. Let's suppose you have a diabetic patient, and the patient is walking, obviously, and wearing even comfortable shoes, but develops a sore on the ball of the foot because there is pressure on it. Diabetes causes neuropathy, so the person does not feel it. Many times the diabetic patient has an overweight problem, so he doesn't even see it well. The diabetic patient can have a problem with the eyesight. So the patient comes home from work, walks on the tile in the kitchen, and his wife looks at him and says, "Honey, what's wrong with your foot? There's blood every time you put your right foot down." They look at it, and there is a silver dollar size sore. And we don't even know how long it has been there, but when they come to the doctor looks at it and can tell if it's a fresh ulcer or it's an old ulcer. Now, part of the treatment for this sore is giving more oxygen. And the two ways to do it is either to give more blood supply to that area, and that can be done by doing a bypass surgery or putting in a stent, a little plastic tube inside the blood vessel. And that increases the amount of blood that flows there, and with more blood comes more oxygen. The other way to do it is, if you cannot do this, the other way to do it is with the hyperbaric chambers. You are put in a cylindrical shaped plastic chamber. We increase the pressure inside from the usual 1 atmosphere to 2.5 atmosphere, occasionally 3. And we give you not 21% oxygen and 79% nitrogen like what we are breathing in normally. The air has that combination, but we give you 100% oxygen. So imagine what would happen if you take a cup of coffee, have a cup of coffee here, and I want to put 20 packets of sugar in it. It's the same thing as having 20 cups of coffee with 1 packet of sugar in each. But I can put it in 1 cup. That's what we do with the hyperbaric oxygen chamber. So the patient goes in for an hour and a half every day, Monday through Friday, and we increase the amount of oxygen that flows to that area with all the other therapeutic modalities, the other ways to help that ulcer, and there's a very good chance that the patient can heal that ulcer. At the Florida Medical Center Hyperbaric Department, where I worked 15 years, 80% of our patients were diabetic foot ulcer patients, and a very good percentage of them, probably 80% or so, I could help with that therapeutic modality, and they healed their
And
ulcers.
I've seen it, and we also, at Florida Medical Center is owned by Tenet Healthcare, and also at Hialeah Hospital, we have an incredible hyperbaric chamber there that also has helped a lot of people. And in Miami, we even had a patient that was traveling from Homestead, taking 3 buses in order to get to Hialeah Hospital because he knew the importance of getting the treatment in the chamber. And that's what I want you to stress to the people that are watching us, the importance of that chamber.
That is. By the way, when I took my first course in that was like 20 years ago or 18, the professor who gave the course in Long Beach, California, he told us the story that the way he started it is he was in the Navy, and obviously the Navy had the hyperbaric chambers to treat the bends. And one day a gentleman came in with his wife and asked that his wife be treated for whatever illness it was. And the professor, who was just an Army personnel, said that I'm not allowed to do it because only Navy personnel can receive the treatment here. So the gentleman shook hands with him, went away, and the next day he came back with a letter in his hand from the Secretary of the Navy instructing the Navy person who is now a professor in Long Beach, instructing him to give the treatment. So it happened so that the gentleman whose wife needed the treatment and the Secretary of Navy were classmates at I think West Point or someplace, of that kind.
Yes.
So that's how he was forced to start it. And he says that's how it started, that I became a professor emeritus here at Long Beach, not because I was so smart, but because I was forced to do it.
Yes. And we have a few minutes. We have a few more minutes. And I wanted to touch upon also how the heart is affected by diabetes as well. Because that's really important, because I think a lot of people don't know that the heart can be affected by having diabetes and being diabetic.
There's a much higher chance for heart attack among diabetics. Again, the same thing happens with the legs. The circulation is lousy. There are calcium deposits, there is cholesterol deposit. By the way, I just would like to mention, there is no such thing as normal cholesterol in a diabetic. The lower, the better. So if a person who is non-diabetic has a cholesterol of 90 or 100, that's normal. For a diabetic, you should go at least below 60 and preferably closer to 30. So the circulation is lousy in the heart. And again comes the problem now with diabetic neuropathy. The diabetic patient loses ability to feel pain. Now the diabetic neuropathy also has paresthesias, fake feelings like burnings or ants are crawling under my skin. That's different. But they lose sensation for the real, actual pain. So let's suppose a diabetic patient is having angina, chest pain, due to problem with circulation to the heart, but the patient does not experience pain because the diabetes took away his ability to feel the pain. So the patient can have a sudden death due to heart attack, or can have a heart attack that shows up on the cardiogram, and the patient is very surprised. I never knew I had a heart attack. I never had pain.
That's correct.
So these are things that your doctor considers. If you are a diabetic and I take a cardiogram on you, I take any little change much more seriously than if you don't have diabetes. Because your ability for feedback And pain is a very important feedback. I told you before that if you have pain, you run to the doctor.
Yes, you did say
If you don't
that.
have pain, you don't know you should be going to the doctor.
That's right.
So that's why it's important that diabetics go regularly to their doctor.
And all
Would you-
people go to their doctor.
Would you like
Everyone has to go to their
If you
doctor.
would like to know, I have my own doctor. I've been going to the same doctor 7 years. I don't doctor myself.
Mm-hmm.
I go every 3 months on an empty stomach. I already hold out my arm because they take my blood. And I go on an empty stomach. And I bring my medication bottles and go every 3 months. And thank God I haven't had any major problems.
And that's really important, Dr. Kovacs, because I go almost every 4 months. So we're right there, side by side.
I
It's
think
very
it's
important.
very, also, obviously, physical activity after your doctor cleared you for it. It's again
Yes.
very important. So I do running and bicycle.
Well, thank you for all the information you gave us today. I mean, I know that everybody's going to learn from everything you had to say.
don't tell me
and
I
we
have
look
to stop.
and we look
I'm
forward to having
I'm
you
so
again on the
happy to
show.
talk and you-
Thank you, everyone, for listening
you.
and watching you and your doctor. We
Thank
really
you.
enjoyed this evening with Dr. Kovacs from Florida Medical Center. Good night.
Good night.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422 and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the